Hello, and thank you for joining us for the ClarityRx All About Peels course. In today's course, we want to talk about what makes ClarityRx peels unique. First of all, we use only the pharmaceutical grade or highest quality grade of acids made available. We believe in the perfect synergy with a low pH and low acid volume solutions to provide us the results in a safe, effective way for our clients. All of our peel solutions are micronized, which means they're quickly absorbed and utilized by the skin. There are no ingredients to minimize the efficacy of our solutions. There is a difference between neutralized and non-neutralized peel solutions, which I'll discuss in a few slides down the road here. All of our peels, however, even with the low pH and low acid volume, are still considered to be superficial peels, really not meant to go any deeper than the epidermis. Remember that all peel solutions cannot be treated equally. Each manufacturer has its own way to manufacture the peel solutions at whatever pH or whatever volume they feel is necessary. In the ClarityRx peel solutions, again, we feel like this perfect synergy is in a low pH, non-neutralized solution with a very low controlled acid volume. What is an acid peel? Well, clearly when you apply the acid in the face or any other part of the body, it works by removing the outer layers of the skin so that a very new, smoother layer of skin is revealed. Cumulatively, these peels have longer lasting effects on texture improvement, tightening, pigmentation, and the overall healthier appearance to the skin. How do they really work? You can think of acid peels really working from the inside out and the outside in. Typically, we're talking about two different categories of acids here in skincare. First being the alpha hydroxy acid category. The alpha hydroxy acid category is a very large category of acids derived mostly from fruit or plants. These acids are known to dissolve desmosomes, which are really those protein bridges or sticky glue that hold dead skin cells together. Just by removing that dead cell layer results in a much more youthful appearance to the skin. Now, typically, BHAs or salicylic works by creating desquamation or shedding as a means of exfoliation. So BHAs and AHAs, although they're very similar, work very differently on the surface of the skin. From the inside out, the action of these chemicals can stimulate the production of fibroblasts, which in turn creates new collagen growth. And it actually provides essential components for healthy, toned, youthful skin. So from the inside out, we're stimulating. From the outside in, we're exfoliating. Let's talk briefly about the alpha hydroxy acids in the ClarityRx line. The first one being our glycolic acid. Glycolic acid, again, for the most part, is a very stimulating, what's known as a vasodilating acid, which means that it helps to stimulate all the mechanisms within the tissue. This is derived from different sources, can be fruit, sour milk, but typically sugar cane is used. Glycolic acid, again, does two things primarily. One is that it's enabling the skin to promote healthy cell turnover. It also eliminates that dead cell buildup on the surface of the skin, and it triggers fibroblast production, which grow collagen, making this acid peel ideal for your more mature, aging skin types or those that suffer from thick, rough texture. Glycolic acid is the darling of most other alpha hydroxy acids in the skincare world because of its multiple uses and multiple benefits. Lactic acid, another alpha hydroxy acid in our brand, is extracted from sour milk. This weaker form of alpha hydroxy acid makes it ideal for the more sensitive skin types or indications for problematic pigmentary issues. There are other types of acids available. Malic acid is extracted from pears and apples. You'll see that quite a bit in cocktails of acids. Citric acid has been used for a very long time to keep the pH of a formula low, as well as to help stimulate the skin. Tartaric acid, known from extracted grapes, is really ideal to infuse or impart lots of antioxidant properties into the skin. And then we have mandelic acid, which is extracted from almonds. This is really a perfect remedy also for breakouts and pigmentary issues. Beta-hydroxy acids really are simple organic acids derived from the bark of a willow tree. This is used in both in our salicylic acid peel at 15% as well as in our fix-it topical acid for home care use. Even though alpha hydroxy acids and beta hydroxy acids share a little bit of similarities, they are a little bit different as well. They communicate with the skin in a slightly different way. Most commonly, beta hydroxy acid, or salicylic in this case, has been used for decades as an acne remedy. Why? Because salicylic acid is a perfect antimicrobial, killing bacterial growth within the pores themselves, as well as an anti-inflammatory, eliminating redness, soreness, or erythema, sometimes associated with your inflamed acne conditions. Beta hydroxy acids are very helpful because they can exfoliate thicker and deeper into the skin, and best for those skin types that can tolerate more. These types of acids have what's known as a vasoconstrictive quality, or an anti-inflammatory quality, as well as an antimicrobial effect. So again, perfect for those that are struggling with an inflamed acne condition, or also really good to help soften the filament in a really congestive, non-inflamed acne. It can also help to minimize the appearance of large pores by simply clearing out the follicular debris and softening the very surface and increasing hydration levels within the tissue through stimulation. The different levels of the acids available on the market really different from manufacturer to manufacturer. There are neutralized and non-neutralized acid formulas on the market. We strongly believe in a non-neutralized formula. Why? The acid's natural state, from the sources of which we use in ClarityRx, really hover between 2.0 and 2.5, meaning they're very acidic by nature. The skin's natural pH is 4.5 to 5.5, which means that it renders it somewhat acidic as well. When companies neutralize their acids, generally what they're doing is raising it to the pH level of the skin or higher, so that we're not eliciting too much change or irritation or erythema in the skin. There are some companies that go real high on the alkaline route at the same time, because that can also irritate the skin enough to trigger some response in the skin. We have found with ClarityRx that non-neutralized free acid states with a pH of 2.0 to 2.5 is enough to stimulate the skin and get the skin to respond with us. However, we do take into consideration the level of acid by volume within the formula itself. Sometimes you can neutralize a pH to render the acid or the formula ineffective or not effective at all. If you're curious to know if a formula is neutralized or not, it usually consists of a base or a sodium. Usually ammonium hydroxide is used to reduce the causticity and raise the pH of the free acid. This in of itself can be very aggravating to the skin depending on what's used. It's like putting salt on the skin. We see more tendencies of allergic type reactions with these types of formulas versus the non-neutralized peel solutions. Keep in mind, we believe at ClarityRx that non-neutralized is best, with a very appropriate pH level, a moderate acidity volume level, and a very safe protocol with extensive training. This is the best way to yield the best results for our clients and to keep them most comfortable throughout the process. So let's discuss some of the indications and contraindications of our acid peels. First of all, what can we really expect from our alpha hydroxy acids? And in this case, it would mean our glycolic and lactic. Very good for excessively dry skin. Why? These acids stimulate lots of moisture into the tissue and proliferate the old and on with the new. And so by nature, it appears to improve extremely dry skin almost immediately. It really works well also on sun damage, as it helps to soften the exterior tissue. It helps to soften rough texture from UVA or UV exposure. It really can help to stimulate all the mechanisms within the tissue for a very overall healthier appearance. We've known to see a few lifting of pigmentary problems with both the glycolic and lactic throughout surfaces, as well as in treatment and home care. The fine lines and wrinkles are some of the most advantages that are known with the use of glycolic or lactic acid peels combined or paired with the home care products as well for optimum results. Really great for those clients that are suffering from a lot of laxity or sagging in the tissue, and exceptional for those very thick textured skin types. Some of the contraindications, as with all peels, by the way, is that if your clients have been on Accutane or currently on Accutane, we suggest that they're off it for a minimum of 6 months, possibly up to 1 year for some of our clients. I suggest that we take a look and let the skin speak to us. The skin should appear as normal as possible, void of any redness, flaking, or irritation typically known to be associated with Accutane. We deal with herpes breakouts in 2 different ways. One is if they have tendencies to have herpes simplex around the mouth or nose or areas on which you treat, and they currently come in with a breakout, it's certainly contraindicated for that day. If they have tendencies for these types of breakouts, yet they're clear of any current breakout, then I suggest we treat them, but that they go home and prophylactically treat themselves with any topical, whether it's over the counter or by prescription, to eliminate potential breakouts, as we know that some of these peels can be pretty stimulating and stimulating enough to create a herpes breakout. So it's inevitable and necessary that we tell our clients to pre-treat at home if possible and to post-treat to prevent any breakouts post-peel. Again, contraindicated over any open wounds or suspicious-looking lesions or any open bleeding in the skin. As we know, these vulnerable areas in the skin will grab these acids and can cause some hot spots, or more importantly, can cause some superficial scabbing, which we want to avoid. Anybody that's currently pregnant and throughout the breastfeeding period of time is contraindicated to receive any acid peels, or for that matter, to be using any of our home care acids. Also, be on the lookout for any clients that may have some autoimmune disease. This just means they may be ultra-sensitive, or that the sensitivity levels in their skin are greater than most and sometimes don't bounce back well, or the healing aspect may be compromised. So be careful with these types of clients. I treat them in the sensitive skin category, making sure that we do patch tests for sure so that they are sure to go through the process of peels okay. I tend to lean towards the lactic acid peel for these particular clients, as it's the best treatment for more sensitive skin types. So what about salicylic acid? Some of the indications, ideal remedy for inflamed and non-inflamed acne for all the reasons that we know of or have discussed already. It's a very strong antimicrobial and a very strong anti-inflammatory, making it ideal to soften the filament within the skin, turn over cellular proliferation so that we get really detox effect and purging effect within the pores themselves as well, and also just to control bacterial growth. We do see some lifting of pigmentation abnormalities with the use of just the desquamation qualities of salicylic, sloughing and cell turnover, imminent when you see that fine sloughing that we sometimes can see. Excellent for very rough, callous skin types as well, as it's known to really soften the texture. Some contraindications that are necessary to talk about is if clients have a known aspirin allergy or sensitivity. I strongly encourage, again, the patch test, but there may be a connection to topical use of this as well, and it may not be a good fit for those clients. So if they're contraindicated to aspirin, there's a good likelihood that they're contraindicated to the salicylic acid peel. Again, any clients that are currently pregnant or lactating, it is contraindicated to receive one of our peels in general. Same thing with Accutane, especially with salicylic acid, because the Accutane clients typically are our acne-prone clients or problem-prone skin clients, which are most likely to use or want to recommend salicylic acid for them. These are the clients that are typically also connecting the dots with the use of Accutane in most cases. So if that's the case, be very cautious and ask a lot of questions. They should really be off Accutane for at least 6 months, but in some cases, again, 1 year. No signs of excessive dryness, peeling, flaking, and redness, soreness that we see associated with Accutane. Typically, Accutane makes the skin excessively dehydrated, which then leads to other unwanted conditions that we see, including increased sensitivity levels, which makes them only intolerant to most of our peels, particularly the salicylic acid, because it's got a little bit of a bite to it. Antibiotic use also is something very commonly seen amongst our acne sufferers. If that's the case, just know that they could be a little bit more sensitive to our services, but also very sensitive to UVA, and UVB exposure to the sun, increasing their sensitivity levels as well. So strong advice with this is to proceed cautionarily and to make sure that they're wearing their sunscreen very diligently, and make sure you pass out that post-peel instruction usage. Again, contraindicated on on any broken skin, and keep in mind that we must always talk to our clients about the use of any low pH ingredient or product formula if they're looking to begin a peel or a peel series. Because any application of these low types of pH ingredients can aggravate the skin so that they may not have a positive reaction to the peel. If they're currently using any AHAs, BHAs, retinols, retin-A by prescription or derivatives over the counter, any benzoyl peroxide, hydroquinones, or any other known low pH product, including some vitamin C serums, within the last week or so, be very cautious. Again, your patch test can tell you lots of things. If the client already has excessive dryness and redness or signs of aggravation in the tissue due to the use of these types of ingredients, or if they're on a therapy using these, then maybe it's best to not go forward with a salicylic peel at this time, or for that matter, any peel at this time. If they are on these, they can also stop the use of these products for 3 to 5 days, possibly up to 7 days, depending on the skin type, before coming in for a service of one of our peels, and to not resume the use of these types of products for at least 3 to 5, and again, sometimes up to 7 days post-peel. Okay, it's more than just a percentage. Again, if your clients are asking for longer periods of time to leave the acid on longer, we just suggest that you strongly follow the protocols that we put in place. It used to be known that alpha hydroxy acids, the higher the percentage, the more progressive the peel solution was. That's not necessarily the case as with our peel solutions. ClarityRx peel solution, again, is the synergy between a low pH non-neutralized acid and a very low volume of acid in the formula, meaning that we're really counting on the pH of the acid and not too much of a neutralized acid to get the result. All peel solutions are different, and they vary, again, from manufacturer to manufacturer. No really two are alike within these variables. So please, again, just follow the protocol that we have available for you. Our pHs are low. For example, if you neutralize, you can see that you can leave a neutralized peel solution on much longer than you can a non-neutralized peel solution. So with ours, they are 3-minute peels, no blending, no mixing, no layering. You can alternate peel solution flavors, if you will, throughout a series, but certainly not combining them within one. Also remember that both the AHA and the BHA peels can be done not only on the face, but very effective on the neck and chest, arms, forearms, backs, and hands, or anywhere where we see unwanted conditions like acne, pigmentation, laxity in the skin. So who's a good candidate for our peels, in my opinion? Taking all of those variables into consideration, the type of peel that we want to use, the time on the skin that we're going to leave it on, how we've prepped, and talked to them about the aftercare, with the exception of severe rosacea or extremely sensitive skin, or those that may be going through other types of therapies. Most clients can tolerate these peels. Everybody with even the mildest skin imperfections through the most severe types of grade 3 acne really can benefit from these types of peels, both the alpha hydroxy and the beta hydroxy acid peels. Remember that the results are cumulative. Multiple peels are necessary to really achieve the goals for the client, so we strongly suggest that these are sold in series with a minimum of 4, potentially 5, up to 6 multiple peels as frequently as every 2 to 4 weeks. Manage your clients' expectations on what we can expect depending on how much they buy into the diligence of the service and the home care products as well. So what should we really be conscious of prior to performing any of the ClarityRx peels? We want to conduct a very thorough skin analysis to determine the skin type and skin conditions and the state of the skin in which we're working on. If the skin already looks like it's in a state of irritation, they may not be a good candidate for a peel that day, or I may choose maybe salicylic acid as an anti-inflammatory or a lactic acid peel as a very mild form of peeling for that particular client. Be sure to ask how they cared for their skin the day of the service, making sure they haven't already exfoliated aggressively with Clarisonic brushes, washcloths, buff pads, or any other types of products, or exercise or shaving or anything that we should know that could create an uncomfortable environment for the client to receive a peel that day. And again, be certain they're not currently using or used up until the day of the service any of the products that contain low pH ingredients. And not to resume these products again for 3 to 5 days or following any of the peels. In some cases, maybe longer. Make sure we choose the appropriate peel solutions according to the findings in your skin analysis. And just for to cycle back here, glycolic acid ideal for your more mature, sun-damaged, laxity, or rough textured clients. Salicylic acid best for your problematic, inflamed, oily acne clients, very congested, keratinized, the appearance of large pores. These all extremely benefit from the use of salicylic. Lactic acid, again, ideal for those suffering from a lot of pigmentary abnormalities, or those that are very thin and sensitive, or those that suffer from conditions associated with other skin disorders like rosacea or dermatitis or other kinds of skin conditions that elicit redness or irritation. Always begin with a patch test on the side of the nose to make sure that we're looking for any signs of irritation, lines of demarcation, increased sensitivity levels, and or raised type of rashes, almost a histamine reaction, if any allergic tendencies as well. Be sure to make them sign the appropriate consent forms and that you're thoroughly explaining to them what they should or should not experience during the peel and after the peel. It's very important that we understand the importance of follow-up with these clients too, so I strongly recommend a phone call if possible to follow up. So when do you really perform a standalone peel versus an upgrade to a facial? In my opinion, if you determine that you need to see the client as frequently as every 2 weeks, then the standalone peel protocol works best. It's not over-aggressively treating the skin with the pumpkin and other elements that are located within the facial protocol. So as an upgrade, it's a little bit more progressive to do it all. As a standalone, you're focusing on the condition-specific peel solution, and it's a 30-minute standalone protocol in that case. If you see the client monthly, or if you've met the goals and are now just maintaining those goals, then it should be included with a regular facial as an upgrade. Throughout the peel, some things to be aware of. It's best that the skin is completely cleansed and dry before getting started, making sure that you're not using any sponges or towels to pre-cleanse. These can be a bit scratchy and can actually exfoliate and make that peel solution feel a little bit more uncomfortable and potentially causing some hot spots. Please use the 4x4s only as indicated in the application of the protocol. I do have some estheticians that are rubbing these peel solutions in with 4x4s. That is completely dangerous with a non-neutralized peel solution. So again, paint these solutions on with the brush provided. Do not rub these peel solutions into the skin. And apply the fan whenever it is on the skin to make sure the client is the most comfortable. Again, 1 layer, 1 application, no mixing, no blending, up to 3 minutes only. Constantly commuting with the client on a scale of 1 to 10, 10 being uncomfortable, making sure that they're as comfortable as possible. And it's normal, by the way, to have a client respond that they're feeling a level of about a 6 or 7 with the first minute or so of these peels. You don't have to leave these peel solutions on for the full extent of 3 minutes. In fact, on some clients, first new time peel solution clients, I will sometimes leave this on for 1 to 2 minutes in the first application just to make sure that their skin can tolerate it well. Again, best performed more frequently than not. So if you can perform these standalone peels at 2-week intervals, sometimes we can reach our goals a bit faster with those clients. However, it does matter if the client's skin type or skin conditions can tolerate the frequency. So again, allowing our client's skin to speak to us to then determine the frequency really does matter. And after the goals are met, monthly peels are recommended to maintain the results. After the peel, we want to make sure that we're recommending the proper home care to ensure that they complement this process rather than to complicate it. The wrong use of products following a peel can really complicate matters at home and increase the potential redness or irritation and prolong the recovery period. Our On the Mend kit is ideal for this purpose. For just around $40, they can ensure that they're using all of the right products for the next couple of weeks. Be sure to hand them out the post-peel instruction sheet. This also gives them ideas on how to carefully care for their skin following our peels. Some of the frequently asked questions that I get is, can you combine peel solutions in one treatment? Not currently. These are all separated by protocol by peel solution. Can I alternate peel solutions throughout the series? Absolutely. If you've got a client that has multiple conditions and you feel that they could benefit by the use of different peel solutions throughout the series, absolutely you can alternate those from one peel to another, just not within the same peel itself. One example is that if your clients have pigmentation and acne, certainly to alternate the lactic acid and the salicylic acid throughout the series of 5 or 6 services really makes a lot of sense. Can you combine peels with other progressive services such as microdermabrasion? Yes, we do have a separate micro peel protocol. We also do certification and training before you can begin administering that service to your clients. So please inquire about that for our ongoing certification for this. It is on our website as well as one of our associate classes that we offer. What do I do in the event of a bad reaction to a peel? We know that there are different types of reactions, one being allergic reaction, one being a result of the service somehow. And in the event of either or, the best solution is to remove the solution entirely by really irrigating the skin with the Take Your Vitamin spray and removing it only with 4x4s, fanning the skin extremely dry and applying a little On the Mend, or for the more severe cases, you can apply the Healing Fine, which is your A&E healing ointment. Nothing else but a sunscreen should be applied. I think leaving hands off at that point is probably the best advice I can give you, and to not keep applying or removing and applying product to do something when just naturally the skin will flush it out, and making sure that we're doing some follow-up on these particular clients. Can I extract after the peels? I don't recommend before, during, or after any ClarityRx peels. This will be on your exam. It's just that our peel solutions in these low pH make the skin pretty vulnerable. We've seen tearing, we've seen hot spots, we've seen some scabbing, we've seen extreme sensitivities to extractions following these low pH peels. So it is not approved within our protocols to extract at the same time. Should you have any additional questions about any of our peel solutions or the protocols in which we provide for you, please let us know by emailing us at education@clarityclinicalskincare.com. The next step to this course is to watch the hands-on video made available, and then, of course, to take the exam. Good luck. Thank you for your time, and have a great afternoon. Bye-bye.